Who do you think would make the ideal candidate to work with you to have you help them with rhinoplasty surgery?
Um, the ideal rhinoplasty patient for me or for any any rhinoplasty surgeon would be someone who has an obvious nasal defect that is very clear to the patient as well as to the surgeon. A patient who can clearly identify the aspects of the nose that they are unhappy about, and the surgeon can agree that these are there, that they can modify it through surgery. Equally important is the mental makeup of that patient. The patient should be affected significantly by the nasal deformity. It could be having a significant impact on their self-confidence, about the way they perceive themselves, and about the way they perceive others look at themselves, look at their nose. Once you have these characteristics, which are usually in younger age group, and once you come for a consultation where we can go through and agree on the aspects of your nose that we can enhance, you will end up having a much better experience and much better outcome from the surgery. Like any other cosmetic procedure, you should not go into a surgical procedure thinking that this is completely going to change your life, and you should definitely not consider it while you're going through a significant stress in your life, because that is not the goal of the surgery. You should have very clear idea about what you want, and your surgeon should agree that these are achievable through the operation.
Fantastic. That makes sense. And I think in terms of, maybe just give us a little bit more information in terms of, do you find that there are, you mentioned a younger age group, is that sort of anywhere, is there a lower limit in terms of a number? Is there a higher limit? I'm sure you must have patients that are also older as well.
So there is a lower limit. We offer rhinoplasty once the development is complete. So that would equate to about 15 to 16 and above for females, and maybe 17 to 18 for boys. But there is no real upper limit. Anyone who is fit and willing to have it any adult can have it at any point in their life. There are certain features which will make you less suitable as a candidate. For example, if you are involved in contact sport on an active manner, then that is not a good idea. If you are into heavy smoking, then it can impact your healing from the surgery. So you got to really consider giving up smoking to have the best out of the surgery. And of course, you need to be physically fit to have the anesthesia and the surgery itself. Equally important is the mental fitness. So you should not take any cosmetic surgery as the thing that is going to change your life. It is there to add to your life rather than change it. So you should be comfortable within yourself, and you should take the idea of the rhinoplasty as something that is going to add to your confidence. It is not something that will completely bring your confidence up from scratch. We have to be very clear that the facial cosmetic procedures are not life-saving or essential surgery. These are procedures which are done to enhance your quality of life. So you should never jump into these operations quickly. You must take your time to understand what the surgery involves, what the recovery is going to be like, and what are the expected eventual outcomes. You need to have a thorough, honest discussion with your surgeon. You should look at their before and after picture. So you should have a very clear picture about what you're getting into and what you're going to get out of it. So I, for one, would never operate on someone who wants it done because there is a discount on offer elsewhere, or because I can offer it much quicker than other surgical provider. Any surgery is not to be taken lightly, and particularly when you are having a surgery which is a lifestyle surgery rather than a clinically essential surgery. Please do take your time, make yourself comfortable, make yourself knowledgeable about what you're getting into, and definitely you should never have a surgery done after being pressurized by a sales agent or patient liaison officers, as might be the case with some national chains. You should decide about the surgery only after you have spoken to the actual surgeon who will operate on your face or your nose or for any part of the body for that matter.